All right, thank you for that. Now, here's a big concern you might not have thought of, and as we take a look at the numbers, it looks like a whole lot less people are being diagnosed with cancer when it's probably out there. They just are scared to go to the doctor. Right now, we're joined by Dr. Gury Doshi with Texas Oncology to talk more about this. Talk to us about your concerns. Are you seeing just fewer patients these days?
Thanks so much, Melissa. We're actually at Texas Oncology seeing a slight decrease in our patients. We know that that's related to decreased screening. At the times of March and April, the American Cancer Society and our local screening radiology facilities had made the decision to decrease the screening mammographies and colonoscopies. We all wanted to decrease exposure to coronavirus, and therefore all of these screening tests were on hold. But now that we are opening up our facilities, we're seeing new patients come in.
You mentioned mammography and colonoscopy, so are you most concerned perhaps that patients are out there with breast cancer and colon cancer who aren't seeking treatment, who need to undergo those tests, those screenings?
So that was a concern for us for the short term, but we are wanting to let Houstonians know that medical care is available and is able to be delivered safely in our communities. If our patients are noticing symptoms, if they detect a lump, if they're having change in bowel habits, or any new symptoms, fever, shortness of breath, chest pain, they really do need to contact their doctor's office and seek medical care.
For those who are really scared to go for any type of screening and they just want to stay home, and we understand that, well, tell us and walk us through what you're doing at Texas Oncology, and maybe that'll give people peace of mind if they do need to go get those screenings.
Sure. At Texas Oncology, we've done a few things that have made a big impact in caring for our patients. Number one, we have started pre-screening our patients, and we'll call them 24 hours before they're to come in to check on them and ask if they've been experiencing fever or shortness of breath, and then instruct them that way. When they do come, we have told them that we have a no visitors policy or a very limited visitors policy, only for those that absolutely need the visitor to help them during their visit. And then when they come, we are employed screening where we do temperature checks. Every patient is wearing a mask. And then we have virtual check-in. So we minimize the amount of time that our patients will be sitting in a waiting room. They'll actually be waiting in their cars and safely come in, see their doctor, and come back to our treatment area. Of course, all the physicians in our healthcare team are wearing their PPE so that we know that we're all being safe. And then, Melissa, most importantly, we've seen the use of telemedicine really help during this coronavirus pandemic. This is a virtual platform which allows the patient and the physician to interact via audio and video, much like you and I are doing here. And we can therefore assess our patients over video. It's comforting for us to see their faces and likewise for them to see us. We'll assess their symptoms and then determine next best steps. But this has helped us reach out to our patients and for them to receive care in the safety of their home. And this is something I hope that we're going to be able to do in the future.
I certainly hope so. And I tell you what, we always say it, and we can't say it enough, an early diagnosis is the best diagnosis and your best bet to fight it. Thanks for your valuable time today.
Thank you.